Hello, and welcome to the Academy of Doctoral PAs podcast series.
I have Dr. Jerry Erickson from Brenau University.
I've worked in clinical practice with family practice and urgent care and PA school. I doctorate of medical science at the University of Lynchburg last year.
Dr. Erickson, the PA master's degree versus other degrees.
PAs are conferred a median of 112 and 112.7 graduate level semester credit hours. Physicians with MDs and DOs are approximately saying with 4 years of 125 to 130 on average graduate level semester credit hours. For psychologists, either a PhD or PsyD, it's average of 110 to 115. So PA education, as it already stands as an entry-level master's degree, is in line or on par, specifically more credits given than most of those professional doctorates. So it's already there.
There is no dissertation required for it.
We all have bachelor's before going into our PA program. That's a requirement now. And every PA program confers a master's. And so it's 28 years and 28 months is the average. And so the 4 plus that's over 6 years. So we already meet the requirements for this professional doctorate.
So to recap, PAs are already earning enough credit hours for a professional doctorate degree. In addition, PAs meet all basic criteria necessary for a professional doctorate degree. In my opinion, the question should not be so much as to whether or not the PA degree needs an entry-level doctorate degree. The question really should be why we're not already getting the degree we're earning. So my follow-up to that would be, if current PA master's level programs were to convert to an entry-level doctorate program, would there be a lot of change to the program structure, length, and price?
Would not be if it wanted to. It may be very minimal in changes. And if there's no change in the time or the amount of credits that are conferred, because as I stated earlier, the average master's degree conferred by PAs is higher than most of the doctorates. So if you're meeting all the requirements, it may not extend the time and it may not extend the cost.
So what's your take on why PA programs haven't converted to direct entry doctorate programs already?
The first PA program only conferred a certificate, and many programs stayed that way and even conferred an associate degree, and then there was a mandate for bachelor's and so on. But it does not negate any of those because they are still grandfathered in. They can still have their state license and national certification for those who already have that. Could be a progression if those programs that want to voluntarily create a doctorate, entry-level doctorate program, and if it progresses just as it progressed from the master's to the from the bachelor's to the master's, I don't think it will be an issue.
What you're saying is that those currently in practice that don't have the doctorate, because of the current standards of the master's and prior bachelor's and certificate, it's not a matter of not being able to practice without the doctorate. It's more of having the degree reflect the education we are conferring.
That kind of goes back to money, because reimbursement. And if obviously, maybe it can be lobbied to, if you have a doctorate, you may be able to have a little more in reimbursement. That's, further down the line and a long-term goal. The progressive thought is to have those, to have seats at the table, to have help lobbying reasons, and to help promote and progress the profession with parity and equity, and for those patients that need it in the end.
Dr. Erickson, can you explain the background of using the doctor title in clinical practice in the U.S. versus other countries?
Absolutely. The title of doctor, it does not belong to MD and DO alone. They are physicians, and they own that specific designation and title. In the clinic, clinical setting, there is no specific reason why that PAs shouldn't be able to. If you look at the perception issue of why they may be able to not use that, is because of the thought that we are not, or that we're trying to encroach on territory that is not ours. We are not trying to impersonate physicians. We are PAs. But if we've earned that specific degree and title, why should we not be able to use the designation? If, yes, people say maybe it's only in the academic setting. However, look in the clinical setting and the other clinical doctorates, dentists, veterinarians. They all have professional clinical doctorates, and there's no specific qualms with them being called doctor because they've earned that degree and title.
So, in essence, a PA using the title doctor in clinical practice is, by very definition of the term, doctor, not impersonating a physician.
Correct. If it's a clear designation on your name badge, that's not going to change. But if the patient chooses, and just as I have way before I completed my doctorate, patients would completely and constantly call me doctor. They said, no, you are my doctor. So the perception of impersonating a physician, which we are not, it's to me, it's all about patient care. And if that's the designation that they want to, oh, doctor means physician. That's not true because there's so many other doctors. And people think that, oh, well, in a clinical setting, the doctor should be the physician who is the head of the team. Well, in a team-based, everyone should have a specific value. And if you've earned the conferral of the degree, you should be able to utilize the title. But if you've earned the degree, you should earn the title.
Thank you, Dr. Erickson. So I'm going to use that as a segue into my next question. There has been a lot of pushback both in professional groups, PAs, physicians, etc., that those professionals who primarily earn their doctoral degree online, such as the current DMS, the PA doctorate degree, that those professional degrees are not as good as other professional doctorates, such as the MD or the DO. Can you please give us your thoughts on that?
Absolutely. For training and education, degree conferrals, certificate programs, associate programs, bachelor's, master's, and other doctorates. Now, as far as the point of view, as far as online, and according to a U.S. Department of Education above, as we state, they are, as far as the amount of degree credits and what we earn, close to 25% of medical students don't even attend class in person, which is basically an online delivery. So what's the difference?